Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years experience, here to talk to you about how hemoglobin A1C is measured. Hemoglobin A1C test is actually a simple blood test done at a laboratory or in your doctor's office, where a tube of blood is taken and an analyzer measures the A1C and comes up with that number that comes in a percent. Again, 6%, 7%, 8%, and the like. The chemical process by which it occurs is quite interesting. In our body, we have blood cells. They carry oxygen and they circulate through our body. They live about 120 days. The sugar or the glucose that's in your bloodstream mixes with these cells, and a chemical reaction happens where they become bound to the red blood cells. And then, based on the analysis or percentage of sugar attached to the glucose, is calculated, and that gives you the hemoglobin A1C. So it's actually a blood test of the chemical reaction. Because blood cells live about 120 days in the body, and they're at different stages of their 120-day life, it's thought to be more accurately reflective of a 90-day average, but it's probably more of a 60 to 90-day average. It's also thought to be weighted more towards the last 30 days than the first 30 days. So it more likely reflects what's been happening more recently than prior to that. It also can be measured in other ways as well. Hemoglobin A1C can be measured at home by a patient. There are some kits that require the patient to do a finger stick, get a drop of blood in the finger, and run it into a little opening or a little tube that may process it chemically in a small kit. Something that would be somewhat similar to a rapid COVID test perhaps, or a rapid flu test that you may do at home. Also, some doctors' offices may have something similar to that will give them a reasonably accurate A1C at the moment of the visit. There are some doctors who will sometimes do that before a visit to know what the A1C is at the time of the visit. However, there are other ways that we can get an idea of what that A1C is going to be when speaking to the patient. So most doctors are often not doing that test, but just drawing the blood and waiting for the results to come back, because they may have a general idea of what the result is going to be even before the test is drawn.